We know that virtual coaching has become more competitive than ever. NASM's got you covered with our virtual coaching course. NASM's virtual coaching course provides a complete solution to help you translate your services into a successful virtual platform. This course will give you the tools to build and operate a sustainable virtual business model. The formats may be different, but you're still delivering fitness training and effective behavioral coaching. That doesn't change even if you can't be in the same physical space as your clients. The truth is, this is the way to reach more clients and expand your reach and impact. There's never been a better time to carve out your very own virtual space, and NASM is here to help. Welcome to NASM's virtual coaching.
Hello, everybody, and welcome to this week's NASM Master Instructor Roundtable. This is Marty Miller, Regional Master Instructor, and I'm here with my fellow Regional Master Instructor, Wendy Batts. And today we're going to do the first part of a two-part series on low back dysfunction. Today we're going to go over what we call flexion intolerance. So first and foremost, Wendy, thank you so much for jumping in here, and I think we're going to have a great topic today.
Absolutely. I'm excited.
Absolutely. So one of the reasons that Wendy and I put this together is we've been with NASM for over 15 years, been in the industry for even longer than that. Sorry, Wendy, to date ourselves there, but we've been around this a long time, and it always comes up to people come up to us and say, hey, one of my clients, or I have low back discomfort, or when I do certain exercises, I feel in my low back, tell me the one thing to do. And boy, oh boy, if it was that easy to go through the one thing to do for low back. So of course, with NASM, we're always going to talk about our assessments. But because low back is so important, we want to break it down into two main dysfunctional movement patterns. Now, remember, there's going to be a lot more that could be going on than just the two dysfunctions that we're going to describe. But at least this gets you going in an organized manner to understand if it's what we call the flexion intolerance, or what we'll discuss next is that extension intolerance. So Wendy, what do you've got to kind of add in that, and we'll get started?
No, I mean, I think you pretty much nailed it. I mean, you know, obviously there's so many people. I mean, as you can see, if we go to the next slide, there's over 80% of the population is going to have low back pain at some point in their time, or, you know, in their life. And so with that being, you know, with that being said, obviously this is going to affect so many people. And we want to be able to provide a ton of information on what you can do, how you can identify it, and then how you can help these people get out of what we're terming as, quote, pain, but really is just discomfort, considering, you know, we're saying within our scope of practice. And so, you know, I think one of the important things is let's actually define what we mean by flexion intolerance. And so basically what we're discussing and thinking about is a posterior pelvic tilt. And so, you know, oftentimes we spend a lot of time discussing an anterior pelvic tilt. However, a posterior pelvic tilt is just as important, because what you're thinking about is now taking your hips, and instead of being neutral, you're actually tucking your hips underneath you. So therefore, you're having a rounded back position. So you're basically in spinal flexion. And so you often see this. It's more common in older adults or people that have been sitting, like slouching in a chair. And unfortunately, during COVID and more people become, you know, getting on, you know, more of their devices and with technology, we're starting to see the posterior pelvic tilt more than we had in the past.
Yeah, absolutely. And I think the key thing here is, you know, when we talk about this, or if we go into next week back into the anterior pelvic tilt, the key thing is we have reiterated this time and time again, I'm sure probably on every single roundtable discussion we've had, is the importance of ideal posture. When we're in ideal posture, that's when the joints, the muscles have the best chance of functioning properly. And that's where the least amount of stress will be displaced through the body. So again, today as we go through, we're going to talk about somebody that is more stuck into that posterior pelvic tilt. And we use that word intolerance because if they go further into that posterior pelvic tilt, it could elicit pain. So Wendy did a great job talking about what we're looking at with our scope of practice. A lot of people say, yeah, my low back bothers me and hurts. well, is it an injury or is it just, it doesn't feel right because I'm stuck in that position? So clearly if there's pain or discomfort and or other symptoms, that's out of the scope of practice for fitness. But if they're just, yeah, I just, when I wake up or sit up or do this, that, I'm stiff, obviously go through your assessment, go through your protocols. And if they start to have an immediate positive response, then, you know, you might be able to continue to work with that person, but just always navigate it. And I know, Wendy, I don't have the exact time to tell you where it becomes something you want to refer out. The key thing is if the symptoms aren't getting better or the symptoms go from, hey, are you in discomfort or are you in pain? Those are two of the kind of first questions I use as a buffer to determine, you know, is this a fitness task that I'm trying to accomplish, or do I need to send them more out for an assessment from a medical professional?
Absolutely. And I think the big thing is really truly being able to identify it. And as you know, we hit on every single week, one of the most important things as a trainer is to really understand and perform an assessment, because the assessment is going to tell you so much information, and then you're going to be able to look at what muscles are overactive, meaning what is causing that compensation that you've noted, and then what muscles are underactive that have allowed that compensation to happen. And again, you know, with the posterior pelvic tilt not being, you know, discussed as often as some of the others, I mean, when you think about the overactive muscles and you think about being, again, in a neutral position, so think about your hips, and I know, Marty, you usually use a cup of water. I do a happy cat or scared dog. But if you think about pouring water out the front, that's an anterior tilt. If you pour it out the back, it's a posterior pelvic tilt. And if you can think about what muscles would take your hips and drive them underneath you, and that's kind of your new normal in a posterior pelvic tilt, the overactive muscles that would cause that would be the hamstrings, the adductor magnus, the rectus abdominis, as well as the external obliques. And so if you kind of put yourself, I mean, just even in this webinar, kind of put yourself into that position, you should feel all of those muscles really get into a shortened position. And so one of the things that are allowing, or three of the main things that are allowing that would be the glute max would be underactive. The erector spinae would also be underactive, and then your intrinsic core stabilizers, of course, are allowing that rotation in the lumbopelvic hip complex. And so, you know, if you can identify it and you have the solutions table, or you're reading through either the CES text or even the CPT, you're going to be able to see the layout of this. And so right then and there, through that one assessment and identifying the specific muscles, now we know how to work on alleviating that posterior pelvic tilt to try to get it back into its ideal alignment, as you said, and which is that neutral hip.
Yeah. And so, I think one of the things is, you know, Wendy did such a great job describing all this, that in the CPT course, you know, we go through this. If you're really fascinated with the anatomy and want to go deeper, the CES, we take that next dive deeper into the anatomy and start to add some nuances to either the stretching techniques, the inhibition techniques, the assessments, to kind of dive deeper even into these the muscles that are causing this. So the key thing there is, you know, identify the overactive, understand what's underactive, like we've always talked about with the model, and get that person back to the most neutral position as possible.
Absolutely, because as we've talked about, the 5 kinetic chain checkpoints, we want to try to obviously get everyone back into that position. So therefore everything, you know, we've got neuromuscular efficiency, which again, just as a term, that just means that the right muscles are firing at the right time and in the right plane of motion. And so that's what the ultimate goal is, either going through the CES or even in phase 1, is to correct these compensations. And so if we go to the next slide, that kind of brings us into really thinking about, you know, the CES continuum. And again, it doesn't matter if you've taken the CES or this, you know, if you only have your CPT. If you think about it, there's so much correlation between the CES and the CPT that you would do a blend. So for instance, in the CES, when we talk about the continuum itself, we're going to inhibit, which means we're going to foam roll those muscles that we have identified as being overactive. Then we immediately lengthen those muscles. And then we're going to activate the underactive muscles. and then we do an integration exercise. So if you're thinking about this on the CPT side of the game, we still foam roll the muscles that are overactive. We still statically stretch them in phase one. Activating is what you're doing in core. And then when you get into integrating, that's the total body exercise that you're doing in the resistance portion. So there's we kind of name it a little bit different, but it really does go hand in hand. And so, I just kind of wanted to point that out, because oftentimes people are like, oh, I listened to some of your webinars and you guys are so CES focused. However, I don't have the CES, and so I don't understand how to move that in. And even though we've done multiple weeks of hybrid programs of trying to blend the two, I just wanted to kind of, before we dove specifically into the flexion intolerance component, I wanted to just kind of remind everyone that this can be done in every phase of training. It's just, it may be done a little bit differently depending on the compensations.
Absolutely. And I use this, and Wendy, I know you use it a ton for the same things, like that targeted or specific warm up before any phase of training. It's just the best way to get the body moving properly before you go into any type of activity. Absolutely.
Absolutely. So now let's go into the next slide, and let's actually talk about, again, what we've identified. So we're foam rolling the overactive muscles. So again, we are going to specifically look at the hamstrings as well as the adductor magnus. And, you're going to roll about 1 inch per second. You're going to sit there. If you find something tender, you're going to hold that specific spot for 20 to 30 seconds or until the pain is reduced. And then at that point, you can move on to another side, or you can start to add some different types of, kind of a pin and stretch type movement as well. And Marty, do you want to kind of talk a little bit more about that?
Sure. So, I mean, even, I'll take a step back even with the muscle groups. So again, I already brought up that definitely look into your CES for more functional anatomy. Today's webinar is not going to hammer just the pure anatomy, but, a lot of your clients or a lot of people say, oh, the hamstring complex. Well, we have different muscles that make up the hamstring complex. And, I think on every other webinar, we've talked about the short head of the bicep femoris, because we're always looking at foot externally rotating and those common compensation. But now we're really going to talk more about the other hamstring muscles, especially the bicep femoris long head, that can now be overactive. And, we know people always overstretch their hamstrings normally when they're in an anterior tilt because they feel tight. But this now would be one of those clients that it's very important to work on that traditional hamstring stretching. So back to that. And the adductor magnus, again, it has two components. Part of the adductor magnus extends the hip, part of it flexes the hip. So that's why you start to see the adductor magnus in here. So when we look at the science of foam rolling, you guys are all knowing it, you've used it, you've practiced it. But again, it never hurts to use those advanced techniques with the pin and stretch where, you go find that tender spot. And when you add some active motion, so if let's say I'm doing my gastroc, my calf complex, and I find a tender spot, I actively go into dorsiflexion. So I start to basically blend in an active stretch with the pressure of the foam roller. And what that does is in the name pin and stretch, it pushes into the muscle and that area that's overactive and kind of keeps it in position. And now while you do that active stretch, it just really helps create a better response due to autogenic inhibition, as well as what you're getting in there with the foam roller. So it's just another great additional technique that you can add to try to get additional range of motion.
Absolutely. And the adductor magnus, oftentimes people have a really hard time with the big foam rollers, getting in there to find it. And one kind of tip that I have found, if I only have like a 3 foot or even a 1 foot foam roller, is if you kind of go more onto the edge of the foam roller and, you just kind of hang your inside thigh on it, you'll find it, you'll know it. It'll light up pretty quickly as soon as you're on it. But again, remember that, we've talked about this a lot, but just as a reminder, remember that there's so many different implements that you could use. You don't have to use just a foam roller. If you want to use a ball or a lacrosse ball or something, just keep in mind that the harder the implement, the deeper it goes. And the smaller the implement, the deeper it goes as well. So if somebody is, new to rolling, try to have them find it using a foam roller, something that's a little bit softer. But just know as you get, more accustomed to rolling, that usually using a ball makes it easier to find, as well as to really get in there and get that, the relaxation that you're hoping to get utilizing the rollers.
Yeah, and one of the things that I always teach when people are like, they're not familiar with the Adductor Magnus or how to find it is if you go back to anyone that's ever squatted heavy and liked that muscle soreness feeling, now looking back, two days later after squatting, my glutes were never sore. It was kind of like right underneath my glute at the top of my hamstring. And it's like, yeah, that's not your glutes. So you didn't train your glutes as effectively as you thought. That is your Adductor Magnus saying, hey, I did a lot of work for those glute muscles. So people are like, oh, yeah, I remember when that used to be sore. So it's kind of hidden up underneath, So I think that's people are like, okay, now I know where the Adductor Magnus is.
And again,
like you said, you'll know.
You'll know. And then, and when you're performing some of the exercises, that's another main reason why we try to get people to stay within the 5 kinetic chain checkpoints. Because for instance, even in a plank, if you're doing that and you bring your feet together and you start to bring your heels together, that's how you know if someone's using their Adductor Magnus or they're using their glutes. Like they'll get into the 5 kinetic chain checkpoints. You'll have them draw in, you'll have them really, focus on keeping a flat back. So they're, really pushing down, they're flattening their shoulder blades out. But then when you look at their glutes, they look like they're squeezing for dear life. You're like, that is money squeezing. But then you'll notice that their heels are coming together or their feet are pushed together. That means it's really more Adductor Magnus than it really is Glute Max. And so that's a huge identifier right there that they're compensating and wanting to use that muscle versus the Glute Max, which is obviously what we're going to try to target, especially in this particular compensation. And
that's a great point, Wendy, because again, we've always said every single exercise is an assessment. And sometimes those little nuances are not noticed. But again, the body's talking to you. It's telling you that either A, they don't know how to do it properly and they're recruiting other muscles, or that's their compensation pattern that, when you stand them up and squat them, you might see it. But that's why we always say every single set of every single rep will tell you something.
Yeah. And then, of course, after we roll, we obviously want to get, we statically want to stretch these muscles. So again, we are going to put them into, the proper stretch. You're going to the first point of resistance. You're going to hold that point for 20 to 30 seconds. Again, utilizing autogenic inhibition. So, after 20 to 30 seconds, you should end up getting a little bit more length because again, these muscles are overactive. So we're not overstretching a muscle. We are actually trying to get proper length tension relationship back into the, from end to end on the joints. And so the muscles that we are going to specifically stretch in this point would be the hamstrings, again, the Adductor Magnus, the rectus abdominis. One of the ways I do that one, again, would be like laying over a physio ball and just kind of like really trying to elongate kind of the abdominal complex as well as external obliques. And so you can also lay sideways on a ball and do that as well. All to their own. Everyone has their particular way of stretching. Those are the ones that are more common that I use. Marty, I don't know if you do any of them that are different, but.
No, those are pretty much it. You can do a little external oblique if somebody has to do it standing. There's a couple of things in my gym, like where you can grab onto something and then you shift your hips, almost like people would classify as an IT band stretch, but I really focus on the upper body. But I like the two that you mentioned for sure.
Yeah. So again, pick the ones that work for you. Just the big thing is 20 to 30 seconds is a long time. People are very impatient and they never hold those stretches for the time that they should. So, as the trainer, clock it, do whatever you got to do, but make sure that they're holding it for that extended period of time. And then, like we just talked about, again, thinking about the continuum. So now that we have inhibited by foam rolling, we statically stretch, so we're lengthening the muscles that were overactive. We really want to focus on, again, the muscles that were underactive. And so these muscles need to be activated because, again, we're trying to restore optimal link tension relationships throughout the entire lumbopelvic hip complex. And so if we, the best way of going about that, we've given you some exercises on the next slide here that we use often to try to kind of really pinpoint some of these particular muscles. So if we go ahead and go to the next slide, we're going to first think about the glute max. Again, the poor glutes, they seem to be underactive very often, unfortunately.
I'm waiting for the assessment where someone calls us and says they found someone with overactive glutes.
Right. Me too. And when that happens, I have not either, which again,
I don't have an answer to that one.
I don't either. But as you can see, you know, and again, put yourself in that position, because very often, you know, people don't think about, they think about anterior, but they don't actually put themselves in the posterior. And so think about, you know, again, even though you're kind of taking your glutes underneath, you're not squeezing them at all times. They're really just kind of there. And if you're sitting in a chair, I mean, your glutes aren't overactive. They're just underactive and hanging out. So one of my favorite exercises.
Rolling them all day long.
I know, right? But one of my favorite exercises that I've talked about every single webinar probably are the floor and or the ball bridges. And again, positioning is super important. Think about the 5 kinetic chain checkpoints. Make sure you're drawing in. Try to make sure your palms are up. And I know there was a question that came in last you know, one of our last webinars of when you're doing a bridge, why do you have your palms up? And one of the reasons is because if you put your palms down and you press down at all, then you're actually putting yourself into internal rotation of rounding of the shoulders, which again is a very common compensation. And especially with someone with a posterior pelvic tilt, because again, the spinal flexion, as well as the rotation underneath can really cause rounding of the shoulders as well as a forward head. And so by doing this, we're just relaxing that. We're minimizing the chances of internal rotation. We're kind of opening up the chest as well. And then you would come up, you would hold for, you know, come up for 1 to 2 seconds, hold for, you know, around 2 seconds. And then you would slowly lower to the ground again, focusing on the 4-second eccentric contraction. So one of my favorites, and I mean, there's so many different ones you can do. This one to me is universal, and I have my clients do it before every phase, just so you know, because I really do believe that it's fantastic for the glutes.
Yeah. Well, it goes back to, you're not going to find someone with overactive glutes. So every single workout I do, even if it's primarily an upper body focused day, depending how I do my splits, I still do glute bridges or some type of hip extension, because whether I'm standing doing shoulder presses, whether I'm doing whatever it's going to do, I still want my core involved. And we know the glutes are part of the core. So this is, as you say, it's a must do, some level, some way, somehow. There's so many different versions, of course, but you know, we got to sprinkle it in there for sure.
Absolutely. And again, the ball bridges is just going to increase your range of motion. You can go a little bit further down. You can come up. The big thing is try not to move the ball in the beginning, you know, just really try to focus on just the hip movement. And again, then you can get into the more creative progressions and regressions that we've talked about multiple times as well. And then of course the erector spinae, there's a lot of different ways, or spinae, sorry, depending on where you're from and how you say it. But, you know, I'm from the South, and so I say spinae, but, you know, about ball back extension. And again, I think it's fantastic. The big thing is you really want to focus on truly allowing your spine to, you know, it's actually in a flexed position. That's unfortunately the compensation. And so what you're trying to do is get the erector spinae to try to fire to get yourself in a more erect, ideal, neutral position throughout the entire spine.
Yeah, and one of the things I see people here do and make the mistake, even if they put this in the right way, even if you are flexion intolerant, you put somebody into a back extension, it's very easy for them to arch their low back. That doesn't mean that's their normal compensation. It's just very easy to have that now compensation while you're doing that exercise. So the key point is you want to be in neutral while you're doing your back extension. So you're trying to correct it. Don't have that, you know, fall into just going right into an anterior tilt. And one of the exercises I see people do that I'm not a big fan of, because it almost forces that anterior tilt even sooner, is like trying to do any type of back extension from the ground. Like, right, they call them the dolphins or the Supermans. You know, it's almost impossible to get to neutral to do any extension. So I just see people coming up from their shoulder blades and their lower body, and now they're in an anterior tilt, but they think that might be the corrective exercise or strategy for what we're talking about. So that's why I like the ball or the traditional back extension. And the key thing is you only have about 10 or 15 degrees of extension of your spine if you have great range of motion in your hips. So you don't need to come all the way back up, and make sure you're not bending at the knees, because now you're using your hamstrings to pull you up. So it's that neutral spine, squeeze those glutes, get those glutes engaged, come up into neutral, maybe just a few degrees past, hold that position, and then go back down under control.
Absolutely. And again, this picture that we have, obviously I couldn't find one up against a wall, but ideally you would want the feet placed up against the wall, put them into triple extension. Again, at that point, you're making sure that you're, contracting your calves, your quads, your glutes, and really drawing in. So therefore, when you're going down, there's not a lot of instability on the ball, and you can really focus in on those muscles, hopefully, and reduce compensations at the same time. And then, of course, intrinsic core stabilizers. One of the ones that I really like is the bird dog, or the quadruped, opposite arm, opposite leg reach. One thing that I've seen a lot of trainers do, and I'm not saying that it's bad, would be to do a plank. And if somebody has a posterior pelvic tilt, they are really flexing at the spine, and that's a compensation. And so in the very beginning, you want to try to think, okay, what are ways that I can actually get them out of spinal flexion? And so the big thing is if you can't get them out of it and cue them out of it, doing something such as a bird dog is an easy way. Again, they're having to fight gravity. They're still having to keep ideal 5 kinetic chain checkpoints throughout the entire motion. I think you're going to have a lot more success of getting the lat, the glute, and everything on a contralateral way to fire correctly before you actually put them into a plank where compensations could easily occur.
Yeah. And also, if you have to regress the bird dog down enough, you could actually put, if it's the right size, stability ball underneath it. Because now you're actually, people are like, oh, it's a stability ball, it's more of a progression. Shouldn't be. If it's the right size ball where they're just like you see that picture there, now you're just supporting their spine, so they even have less of their spine and the muscles to activate to control that. So that would actually be a regression by having them do the bird dog on an appropriate size ball. Sometimes I see people do it on too big of a ball, and now they can't keep their balance because they can't get their leg to the ground and things like that. So make sure it's the right size.
That's a great point. Also, though, too, if you do utilize a ball, like Marty said, it is going to help with, specifically really trying to maintain ideal alignment. However, a very common compensation, again, with this typical client is that they're going to want to flex over the ball. Correct. Because, again, if they're not really drawing in, they're really not paying attention to the lumbopelvic complex, and they end up going over the ball and use it as a protectant, then you're really not, you're feeding into a compensation that we're really trying to get them out of. And so, just things to think about. Again, see what your client can do. If opposite arm, opposite leg is too challenging, just try one leg at a time and then bring in the arms as well, and then do it together, as one unit. So again, many progressions until you can get to this where they nail it. They've got proper alignment. But to me, these activation exercises are fantastic for this particular compensation.
And one thing that I would say, it's funny, I was in my gym and someone saw my NASM shirt, and we have a young soon-to-be trainer in there who's aspiring to be an NASM certified personal trainer. And I was like, great, you're your first client, practice everything. So what I mean by that is, Wendy and I would say, okay, this person's going to use the ball, this person's not, this person's going to use this. But most people need to learn by seeing. So if you can't demonstrate the exercise properly, it's going to make it harder for you to verbally coach somebody through. So again, you don't have to have the same amount. Wendy works with a ton of elite athletes right now. She doesn't have to demonstrate the same amount of weight, but she has to show the proper exercise execution to be able to show how you move the spine back and forth or whatever it is. So make sure that any exercise that you want to use in your arsenal, that you can demonstrate it, so that way they can visually see it. Because most people are going to learn very well. Like, don't tell me what to do, show me what to do type of thing.
Right. And I'm a very visual learner myself. And so, again, that show, tell, do is going to be super, super important. And again, we've talked about this, because if you tell me to do something, I think that I'm doing it. So if you show me, this is what you're doing, this is what I want you to do, totally different. And remember, as a trainer, we have to at least do 2 or 3 that are perfect. And then after that, so that's what I always say. Just make sure you own at least 2 or 3 of them. And then hopefully you're going to be able to work your way up of doing the proper amount of reps, as well as the tempo accordingly. But just want to throw that out there.
Fair enough.
All right, so let's actually go on to the next slide here. So again, still following the corrective exercise continuum. And again, this could also be utilized in the total body component in the CPT if you're following the template. And so what we're trying to do here is we're trying to integrate the body, upper and lower body, and get it firing and functioning correctly. Because again, if you think about it, we inhibited muscles, we lengthened muscles. So now we've got this new length. Now we've activated muscles that were underactive. So now we've got this activation. But now we need to make sure that the brain, the body, and everything knows how to control all of that together and how to utilize it in one proper movement pattern. And so as you can see, when we're talking about the integration components, you're taking something lower and upper and bringing them together. And, oftentimes in the CES, you're going to notice that we usually just choose one or two exercises. Because again, remember, the CES you could do as a standalone workout, or you can then integrate it as this is your warm up, and now you're going to go right into resistance. And so Marty and I's favorite, we say this all the time, but we do the cable squat to row. You could do a single leg cable squat to row as well, depending on what your client can or cannot handle. Again, though, the big thing is if they're coming into a posterior pelvic tilt, you're going to have to make sure that they maintain those parallel lines. And so oftentimes they're going to really want to go into spinal flexion now because the resistance of the pull with the cable. And so it's going to be very important that they maintain proper alignment when they're going down, and then when they're coming up too, that they can fully get into a neutral spine and then do the row correctly to work on trying again to get those muscles in the back to fire, because they're probably weak as well. Because again, with the posterior pelvic tilt, very oftentimes you'll see the rounded shoulders and forward head.
Absolutely. You're always going to see a squat to row.
Yeah. Do you want to talk about the next one?
Sure. So, there's a lot of other exercises that are great. So we just want to pick kind of like, 3 easy ones that I think everyone can execute reasonably easily from the client as well as the trainer. So ball squat to scaption. So again, the key thing is, remember, at some point, no matter how, stable your spine is, if you squat too far down, you're going to tuck back into a posterior tilt at some point. So remember, it's not how far down you go. It's, can you get close to parallel while maintaining neutral? If you go much further than neutral or, parallel, you're going to tuck back under. So we want to avoid that with anybody. Most times, there's very few times that we would say squat as deep as you can go. We've talked about that in other webinars. So just make sure that, because the ball's there and they've got a little more stability and maybe even cleaned up some of their ankle range of motion, make sure they don't just all of a sudden drop all the way down again, because now we're right back to where we started with that posterior tilt. So right to neutral at best, and with their spine in parallel with their hips. Scaption, we want to, again, as Wendy said, bring something upper body, lower body together, which means you have to activate your core more. So scaption's a great way, yes, you could do alternating curls, depresses, things like that. But, we love the scaption because it gets the rotator cuff going. And when the weight's out in front of you a little bit more, activates the core as well.
Absolutely. And a big thing about any of the squats that you do, as well as the next one, which is the step up to overhead press, you want to make sure each and every time that the client comes out of hip flexion, and that they fully engage their glutes. Again, we know that muscle is underactive. And so therefore, if we stay in a hip flex position in the squat, we don't fully come up and squeeze the glutes, then at that point, we're really not activating it. And then, and again, the primary, muscles in a squat are your quads as well as your glutes. And so you want to fully activate them each and every time. And then when we talk about the step ups to overhead press, again, you can choose any ones you want, and you can do the step ups in, multiple planes of motion. So it doesn't even have, it doesn't always have to be sagittal. It could be frontal or transverse. Mm-hmm. But the big thing is just making sure that, again, when they step up, they're coming up, they have parallel lines. They fully stand up. They go into full hip extension. So again, maintaining and squeezing their glutes. At the same time, the floating leg, we always say to go into triple flexion, because as we talked about when we did the back extension, we were doing triple extension. Now we want to flex the foot, the knee, and the hip. Again, we mimic the gait. You might as well get more out of your training by doing stuff you do every day. And so, again, making sure we have ideal posture. And as long as there's no compensation with overhead presses, I think it's great. Again, if somebody does have rounded shoulders and they do have flexion of the spine and they do have a posterior pelvic tilt, oftentimes, again, you have to think about the lat extensibility. So, just be very cautious and careful when you start to do overhead motions in any compensation that you see, especially if the arms fall forward in the assessment. However, you may see this too with rounded shoulders. If somebody doesn't have the extensibility, they may want to compensate. And so you just want to, eye that and make sure that they're doing everything perfectly, executing the acute variables as well as form and positioning. And you should have some great integration options to help somebody with this type of issue.
Yeah, and what works for me is doing one arm overhead press. You can either do alternating, so that way you're changing the demands on the body, or if I'm starting somebody out, there's a couple different ways you can do it. But if my left leg is the one on that's driving me up, I'll do the press with my right side. So I do that opposite side contralateral. So in that way, I take away the need to have that extensibility in the lats by having both arms up.
Yeah, I mean, again, just use your best judgment. I mean, you know your clients, and again, I mean, Marty and I are kind of, preaching to you guys every week about the same things. I mean, and hopefully it's kind of starting to click that that you don't have to be it's not rocket science. It's basically just look at form based off of your assessments and choose exercises that they're going to be able to execute correctly. So therefore, you're going to really help maximize proper movement patterns. So then you can move them up, throughout the 5 phases of training and getting them to their goals.
Correct.
Yeah. So if we go, let's go to the next slide here. And again, I know that this was more of a shorter webinar, and it was mainly because we just wanted to really talk about one that we don't see as often. As we mentioned before, we are starting to see this more and more frequently. And, the key thing is keep your exercises simple, and there are multiple ways of, this one compensation could also have a lot of other compensations with it, as noted. But as we've talked about, try to keep the programming in an hour or less. So if you need to give them take-home exercises to foam roll, or take-home things to foam roll. So, if there's other things that you want them to focus on, that's great. I mean, we were just specifically focusing on this one because we keep hearing all this stuff like, oh, can you do something on low back pain? Can you do something on low back pain? And we're like, yeah, we totally could, we could do a ton on low back pain. So we wanted to start here, but just think, the programs that you're doing and the one that we actually discussed is more of a corrective exercise program. So this program, any of the exercises that we just discussed, as well as the foam rolling and stretching, this could be done 5 days a week, easy. And it's not a workout. And that's the big thing. And I want to reiterate that it's not a workout. This is a corrective movement pattern to help with the dysfunction that we noticed in the assessment. And so, that's why, again, the next point, assessments are key, and really being able to identify it. The easiest way is from the lateral view. If you notice that they've lost that normal curve, it looks like their back and butt kind of blend together. And, when they go into a squat, they kind of tuck underneath, then that they're checking positive for a posterior pelvic tilt. And so that's why correcting your clients each and every time, 5 kinetic chain checkpoints, drawing in, perfect alignment, that is going to be paramount for everything that you do. So therefore you can really try to activate the muscles that need to work and lay off the ones that have had enough.
Yeah. And, it's funny. So, kind of the key takeaway is today's a perfect example for me, is that I missed my morning routine, which is my corrective strategy. It has nothing to do with my workout. And, when people, we first give this to them, they're like, oh, you want me to do this every day? I'm like, well, you floss your teeth every day, right? You do it because it's good for you, whether it's 5 minutes, 10 minutes, whatever. But eventually when you
floss your teeth for 10 minutes?
No. I think this program could be 5 or 10 minutes. But me, I would floss my teeth for 5 or 10 minutes.
You probably would, yes.
That's a whole other note. So let me reiterate that again. This corrective strategy that you want implemented daily could be short enough to be 5, 10, 12 minutes. It doesn't have to be 40 minutes, right? But just like people do other things as a health preventative every day, such as floss their teeth for a minute, people get in a routine. But the key thing is they start to feel better immediately, because let's be honest, 1 or 2 sessions a week is not going to necessarily always do it, because there's a reason they're falling into that compensation, whether they sit at their job, they have a 45-minute commute. So don't overwhelm them at first, but eventually when they start to move better, feel better, you'll see that they're probably going to do it more frequently in the homework. And, you know, the only other key takeaway, because Wendy, you did such a great job, is be careful how you program the cardio, because putting them on a recumbent bike, putting them on a bike, like, you know, and again, my term is that accidental exercise. That's why sometimes for certain people, I love to get them doing nice, you know, long gated walking patterns. I like them to do standing and doing battling ropes, or shadow boxing, so they're getting some transverse plane motion, or a stair mill potentially. So that at least they're getting, you know, some, if they have good posture and everything. So even think about their posture, how they're doing their cardio, because you get somebody who sits at their desk for 8 hours a day, has an hour commute between 2 half-hour drives. Then they come in and they just like, you know, I'm going to do 30 minutes on the recumbent bike. Well, now I've just fed even more into it, even though they are burning those calories. So those are the type of things that where it just becomes easier and easier for you to fix these by identifying what's feeding in, as Wendy used the term one time, feeding into their compensation.
Absolutely. And then think about this too. I mean, it's not very attractive when you're sitting there and you're all slunched over. I mean, how many times did you hear growing up, like, sit up straight, keep your shoulders back, keep your head back?
Our grandmothers were so on it back then, right?
Oh, I'm telling you. I know. And so, I mean, they were, like you said, they were onto something without all this science, you know, behind it to support it. I know. But I mean, you know, you look better. And when you look better, you feel better. And then think about, you're going to breathe better, because again, you're kind of opening up your chest cavity, as well as, you know, giving your diaphragm a chance to actually, you know, work the way that it was supposed to. So there are so many positive benefits. And again, you know, we're not here to fix pain, but we are here to correct movement, posture, and again, you know, just taking the time to identify it, really focusing in on you know, the proper form. I think that's key, because again, with spinal flexion, it'll creep up on you, and and you really want to make sure that they don't slide that in and you didn't notice it.
Yeah, and I think I've told you this story before, Wendy. I think it happened to me twice. Two people said, you know, you have really good posture, and I'm like, you have no idea how, like, that's a compliment to me, because it's
absolutely
that constant struggle of always working on it. So, you know, people do notice when you have better posture, for sure.
Absolutely. Yep. So I don't know if we have any questions today, but you know what, I'll just go ahead and let you guys know how to contact me. So if you do have some questions that we missed, you can let us know. But the best way to reach me is via email, which is wendy.bats@nasm.org, or you can always find me on Instagram, which is wendybats13.
And then for myself, marty.miller@nasm.org. And then Instagram is dr.martymiller72. And of course, because our boy Prentice wasn't here, I did forget to say that Greg, the man behind the scenes, is going to do an amazing job today. And he has done an amazing job, our producer, keeping everything going. So Greg, you know, you're never forgotten about. So thank you, Greg, for keeping this thing running smoothly. So thanks, Wendy. And this was a blast. And next week, of course, we're going to go the opposite side and do the extension intolerance.
Yes. Looking forward to it. So, all right. Thanks, guys.